Professor, appreciate your time. I see you wrote an opinion piece this week, and I saw that you kicked off with this line. You warn that if Australians don't get vaccinated soon, you say we may succumb to a massive wave of COVID-19 that we won't be able to stop. It is an alarming thought. What makes you think that we could be heading down that path?
Well, the problem is the variants. These new variant viruses are much more transmissible. And I mean, double or triple the transmissibility of the original virus, and that was bad enough. And the problem is a very, very transmissible virus is very hard to control if it takes hold in the community. Lockdowns even and masks may not be sufficient to control an outbreak if it's very, very transmissible. And the Indian variant, now called the Delta variant, that is circulating in Melbourne, at least as far as we know. And indeed, it is very, very, very transmissible. So the best way out, frankly, the only way out of the risk is to have a highly vaccinated population. And that is why I suggested this is urgent, and I believe it is.
So, Nick, when you look at the data, do we know just how much deadlier these new COVID variants are and how it is affecting, for example, younger people being more susceptible to bad outcomes with these new variants? Is all of that clear just yet?
It's not totally clear. We know the new variants, particularly the Indian one that I mentioned already, is very, very transmissible. It's not more deadly, but of course, if more people catch the virus and get sick with the virus, there will be more deaths because it's a numbers game. There's also some emerging data in children that the risk is much higher, both of transmission and potentially of illness. It's a little bit unclear, but possible, which would mean more risks in schools if there's a major outbreak. So look, this is really serious. It was bad enough before, it was really serious then, but this is even worse in the sense that this is higher risk. And yet we also know the way out, and that's the vaccination program being pushed out as quickly as possible.
So, Professor, when you hear politicians tell us this isn't a race, there's no burning platform, like we've heard from Scott Morrison, from Michael McCormack, from a range of politicians over recent weeks and months, how do you react to that?
Well, I think things have changed. I think with the old wild-type virus, the original COVID, if you like, they were right. We were controlling it with the public health measures very well. We were aggressively suppressing, not quite eliminating, but very close. And if there was an outbreak, it could be usually quickly controlled, for example, with short, sharp measures. And that's worked very well, for example, in New South Wales. But these new variants, unfortunately, are like a new game. There's a much higher risk. We know from overseas work that this risk is there. It's real. It's not something imagined. We're seeing in Melbourne the latest outbreak, which is particularly concerning. And of course, if the virus takes hold in Victoria, it could leak out to the rest of the country too, even with the measures currently in place. So there really is a high risk situation. So I think it's changed. I think it's fair to say the politicians were on track, but now it needs to be reconsidered with the new emerging data and the new crisis, if you like.
This outbreak in Victoria has spurred a lot of people to get out there and get these jabs into their arms, but there still is that group, and we know that it is still a substantial group of people who are concerned about the blood clot risk associated with the AstraZeneca jab. How do you see the downside of that risk compared to the upside of the vaccine?
Well, we know there is this very rare risk of thrombosis, of clotting with low platelets. It's a very, very specific syndrome. It's about 6 people in 1 million who get the vaccination. The numbers vary a bit, but round about that. So it's rare, but it's real. The good news about this is it's now well recognised. It's being recognised early in almost all cases. It's treatable with newer anticoagulant drugs. So we've got a clear pathway for what to do if someone presents with this rare but important syndrome. And of course, on the upside piece, well, frankly, getting COVID is so much higher risk than getting the clotting problem from the vaccine. COVID, if it's circulating in the community, will kill up to 1 in 100, maybe a bit less, but around about that. It'll hospitalise maybe 10 to 20 in 100. That is really, really serious. That's much, much, much greater risk. And so I think the people in Melbourne are doing the right thing getting the shots. But let me just remind you, to protect yourself from, for example, the Indian variant, the Delta variant, to get maximum protection, you need both shots. One shot gives some protection, but not quite enough. So that's one of the dilemmas. How do we vaccinate enough people with both shots so that they're protected, and of course their loved ones and other family members and the rest of the community is also protected by the vaccination program? That's the crux of the matter. That's why I'd argue it is urgent.
Nick, just finally, we seem to see this furious debate among medicos about the science telling us that COVID is airborne. How do you rate Australia's reaction to the latest information we have on that issue?
So I think the evidence is overwhelming that transmission occurs from people just talking or not even coughing, not even singing, just doing normal things. The virus gets into the air and it stays in the air if the ventilation is poor. So being outside is actually pretty safe. Being inside, where there's poorer ventilation with someone who has COVID and other people may not have COVID yet, that is the risk situation. That is where super spreading can occur. And the old theory that it had to be droplet and it really had to be short distance just doesn't hold up with the science. So I think the views of the vast majority, not everybody, but the vast majority, including World Health now and the CDC in the United States, is that airborne transmission is a major route of transmission, and we need to pay attention particularly to ventilation indoors to protect people. And I'm hoping that advice will sink through right across the hotel quarantine system, of course, and also if there are outbreaks in terms of the public health measures being taken.